Joining us on the phone is Arizona Senator John McCain. Senator McCain, good morning.
Good morning. How are you?
Wonderful. Thank you. I think this is your first appearance on our Business for Breakfast show.
Certainly since the election.
And
everybody comes up to me and says, I voted for you. I voted for you. I'm thinking about demanding a recount.
You know, it's kind of interesting to me, the ebb and flow of issues that take place in Washington, D.C., and I was thinking back to the campaign and the debates you and Mr. Obama had. I don't recall health care being in the spotlight. How does it move into this position of prominence like this?
Well, I think one thing is obviously the president's agenda, and he sets the agenda. That's one of the results of elections, obviously. But there was, when I made a health care proposal, as you know, that we would do away with the tax exemption for employer-based health benefits, and I want to emphasize $5,000 refundable tax credit for every American family. The Obama campaign spent millions of dollars probably attacking that position more than just about any other expenditure of their campaign. So although in the debates it didn't come up so much, in the last debate it came up because I questioned then Senator Obama about the, quote, fine that that businesses would pay that didn't have health insurance for their employees. But he certainly attacked my proposal on employer-provided health benefits, and probably spent more money on that than any other attack ad that they ran.
House Speaker Pelosi seems to think they're going to get a bill done before recess. Do you think that's possible?
Well, Harry Reid, the majority leader of the Senate, announced yesterday that they would not have it done by the August recess. And so that doesn't mean that by any means that they've given up, nor does it mean that they will fail in the long run. But it certainly is a setback because they had wanted to jam this thing through before the August 7th recess.
The perception is, and I certainly think it's true, that this is a Democratic bill or bills that are being looked at right now. And I guess the question is, where are the Republicans here? What are they doing?
Well, first of all, we're trying to expose the contradiction between expanding health care in a way that increases government involvement and at the same time saving. They're claiming that they're reduced health care costs, and that a hole was blown in that a mile wide by the Congressional Budget Office, as I'm sure you heard about their report last week. But we Republicans have come up with several proposals. Dr. Coburn, Tom Coburn, and Burr of North Carolina have a proposal. Judd Gregg has a proposal. There's several others out there, I guess. So we have had alternatives to what has been wending its way through the House and Senate on a pure party line basis. What I strongly have suggested is that now that they haven't been able to meet the August 7th date that they said they wanted to make, why don't we all sit down together for the first time, Republicans and Democrats, and see if we're in agreement on incentives for wellness and fitness. We're in agreement for outcome-based treatment as much as possible. We're in favor of expanding community health centers. We're clinics. We are there's a number of areas where we could come together in agreement, and I think that we could maybe be able to resolve the most contentious issues, which, as you know, are, one, the so-called government option, and two, the requirement for employer provision of health insurance or paying a fine for their employees.
This GAO report you talked about doesn't seem to come up much in discussion. It's being brushed aside almost.
Well, it had a huge impact up here. It really did. It had a huge impact because the argument that we were going to save money by health care reform and bring down costs, the Congressional Budget Office, by the way, which is a Democrat appointee, the majority in Congress gets to appoint the head of the Congressional Budget Office, and so it really did have a huge impact here. And the director, a guy named Elmendorf, showed a lot of courage, I think. By the way, he was invited over to the White House a couple of days ago for a meeting with the president.
Right. Now, Senator McCain, it's true that the CBO scores all kinds of proposals that are being sent over there, and there are 5 different bills out right now, and there was one particular version that he didn't like. But it seems to me that we have to do something to stop this increasing cost. We cannot continue the way we are. And it's been years and years and decades, and something has to be done. I think the public is tired of nothing happening. And so it would be great if everyone could get together and come up with some solutions that make sense for the public. And it's hard with all of the special interests. You have to admit, Democrat and Republican sides are getting tremendous contributions and tremendous pressures from health insurance companies and providers and everybody else involved.
I totally agree with you. Let me just give you one small example that we could look at. Probably the best-known witness up here is the CEO of Safeway. Safeway has enacted health reforms for their employees, incentives and rewards for wellness and fitness, specific rewards for not smoking, for joining a health club, for giving people actual cash for not using unnecessarily their health insurance plans, et cetera, et cetera. And they have actually reduced health care costs for the Safeway. And those kinds of proposals are very important. Second of all, could I just point out just 2 more points? One, that outcome-based treatment is something we have to go to. In other words, you get a treatment that has a certain medical problem, and you and you pay the healthcare provider a certain amount of money to make sure that patient one, it becomes healthy, and 2, is subject to a hospital readmission, as you know, which is a huge problem within days. So those are important items that I think we've got to bring into play here, and I think Republicans and Democrats alike could agree.
Senator McCain, thank you so much for joining us this morning. We didn't get to the stimulus plan. Maybe we can get you back on sometime very soon.
Come
to
back
talk about
and visit us.
Yes.
But I just mentioned it looks like the economy's showing some signs of recovery. Let's pray it does. Arizona and Phoenix are very hard hit.
You bet. Thank you so much.
Thanks.